Hi, my name is Taylor Purvis. I'm a University of Manitoba student nurse, and today I'm going to be demoing an intramuscular injection. So the first thing we're going to do is we're just going to check our scenario here. So our scenario is med demonstration part 2. The date is February 7, 2021, and the time is 20:30, and we're going to be administering medications today. So after I've done that, I'm just going to compare my physician's order with my MARS. So we have Jake Nursing, so that's right patient. Date of birth, January 1st, 1960, January 1st, 1960. So those are his two unique identifiers. So he has no known allergies, so that is good. I'm just going to note that all of these drugs have been properly transcribed and double signed, and we're going to be administering medication today for uncontrolled nausea secondary to chemotherapy. So we'll go with our first drug here. So we have metoclopramide, right drug, 5 milligrams, right dose, subcutaneous, right route, and daily, right frequency. It's written here once daily at 0800. On the 7th, it was given at 0825, and that's today, so we don't have to give this drug now. So we have diamond hydrogenate, right drug, 150 milligrams, right dose, intramuscular, right route, daily, it's the right frequency, so it's written once daily at 2100. It is the 7th at 2030, so we're within that time frame, so I'm going to be administering that drug now. So after I've checked both of those, I'm going to put my physician's order away, and I'm going to get my right drug here. So I'm going to be comparing my drug with my MAR. So we have Jake Nursing, January 1st, 1960. He has no known allergies. So we have diamond hydrogenate, right drug, 150 milligrams. This is 50 milligrams per ml, so that's the right. So we'll get 3 mLs of this, which will give us the right dose of 150 milligrams. So that's correct. We have intramuscular, so this can be given intramuscular, so that's the right route. And it's to be given daily, so daily at 2100. It's 2030 now. On the 7th, we're within the time frame, so we can give this drug now. I've just checked to make sure that this drug is not expired, and it is not expired, so that is correct. So next thing I'm going to do is I'm going to check the parenteral drug monograph, and in checking that, I noticed that it says maximum single dose of 100 milligrams. And here we're supposed to be giving 150 milligrams. So I did call the physician and the pharmacy to clarify, and they did say that I can administer 150 milligrams of this medication safely. So I'm going to go ahead and do that as per doctor's orders. So other things that I checked on the drug monograph were alternate names. So it can be called Gravol. It's an antiemetic. It may be administered by a nursing student, so that's good. It can be given intramuscularly. Intramuscularly, it's to be given administered undiluted, so that's what we're going to be doing with the maximum concentration of 50 milligrams per ml, which is what this is. So 3 mLs of this will give us 150 milligrams, so that's correct. So I've also looked over potential hazards and any other additional information that was on the drug monograph. So after I've done that, I'm just going to talk a little bit about the indication for this medication. So for this medication, we're going to be using it for the reduction of nausea and vomiting secondary to chemotherapy. For this patient, so its antiemetic effects work by blocking H1 receptors in the vestibular system. So we've already talked about the max dose, and it is safe for us to give 150 milligrams, so we are going to go ahead and give that. Some common adverse effects of this drug include drowsiness, constipation, and blurred vision. Some contraindications for this drug include nursing mothers, hypersensitivity, and people with asthma. Some drug interactions for this drug include increased sedation when taken with anticholinergics and other CNS depressants, such as things like opioids and alcohol. Some nursing implications include assessing the patient for nausea and vomiting, their ins and outs, their daily weights, their vital signs, their hypersensitivity for signs of dehydration, and also their serum electrolytes. So after I've done all of that, I'm just going to go ahead and I'm going to wash my hands, and I'm going to grab my right supplies here. So I'm going to be using a 3 ml syringe because I'm going to need 3 mLs of this medication for the right dose. That's correct. I'm going to get a blunt fill needle, and I'm also going to get my correct injection needle. So here I have a 22 gauge and 1.5 inch needle. So this is correct because I need 22 to 25 gauge. This is 22, so that's right. And I need a 1.5 inch needle because we're going to be giving this medication in the ventrogluteal because it is a large amount of 3 mLs and it is for an adult. So after I've established that this is the correct needle, I would normally check to make sure the integrity of this packaging was good, but obviously for demo reasons, I've reused these. Also, I'm just going to note that the side of my syringe here is rubbed off, so I'm going to try my best to show that I've gotten 3 mLs, but just note that it is rubbed off and not as well as it was at the beginning. Okay, so after I've done that, I'm going to wash my hands. I'm going to open a alcohol swab, and I'm going to throw that in the garbage, and I'm going to clean the top of my vial for 30 seconds in a circular motion. So we're going to say that was 30 seconds for demo purposes, and I'm going to let that dry. That can go in the garbage. So after I've done that, I'm going to wash my hands again, and I'm going to get my syringe ready here, making sure I'm not breaking any of the sterile aspects of this syringe. I'm going to open my blunt fill needle, making sure not to break the sterility of the any of the sterile aspects. I'm going to throw that in the garbage. So at this point, I'm just going to draw back my 3 mLs. Okay, so from here, I'm going to take the cap off and I'm going to put and insert this into my vial. Okay, and I'm going to inject all of the air. So for demo purposes, this vial is not the best because it has been used so many times. So we're going to draw back 3 mLs, a little more than 3 mLs. So once I'm sure I've gotten the right amount, I'm going to flip this upside down. I'm going to take this out and I'm going to recap this using my scoop method. Okay, so that's good. At this point, I'm just going to knock out any bubbles that I might have in my syringe. So once I'm sure that I've gotten all that, I'm just going to pull back and make sure that all the medication is out of the blunt fill needle and in the syringe. So from there, I'm going to remove this. I'm going to dispose of this in the sharps container, and I'm going to open my injection needle, making sure not to break the sterility. Attach that, so I'm going to throw this in the garbage. So at this point, I'm just going to calibrate to the right dose, and I'm going to be doing this over med waste. So I'm going to push up, making sure that we don't have any bubbles. Okay, so now that I know that we don't have any bubbles and this is the correct dose, I'm just going to put this down so my photographer can look at the right, go this side too. So this is the 3 here and then the line to make sure. So once I've done that, I'm going to label my syringe. So we have Jake Nursing. The drug is dimenhydrinate and it is intramuscular. The dose is 150 milligrams. The volume is 3 mLs. The concentration is 50 milligrams per ml. The date, so it's February 7th, 2021, and it is 2030, and TPUMSN2. So I would immediately label my syringe here. I don't have the sticky labels, but I would stick this to the needle cap, but for demo purposes, I cannot do that, but I'm gonna say that I did. So at this point, I'm gonna go ahead and I'm going to do my second check. So we have my syringe, my label, my drug, and my MAR. So we have Jake Nursing, right patient, January 1st, 1960. He has no known allergies. So we have dimenhydrinate, this is dimenhydrinate, that's correct. And then we have dimenhydrinate in the syringe. We have 150 milligrams, This is 50 milligrams per ml. So we're gonna need 3 mLs of the solution, which is what I have here with no bubbles. So that is the correct dose of 150 milligrams, so that's correct. We have intramuscular, this says that it can be given intramuscular, and this is in fact an intramuscular syringe, so that is correct. It's to be given daily, so it's written here 2100. I have the time here is 2030. We're on the 7th at 2030 within the time frame of the 2100, so we are safe to give this medication now. So we're going to do that. So after I've done that, I'm just going to, this is a multi-dose vial, so I'm going to put it back in the med room where in the appropriate spot. So after I've done that, I'm just going to gather my supplies. So I'm going to get my clean gloves. I'm going to get my cotton ball. I'm going to get an alcohol swab and my MAR, and I'm going to wash my hands before I enter the patient's room. So I'm going to enter the patient's room, and I'm going to be signing my MAR today with a pencil just for demo purposes, but I want to note that I would normally use a pen. So I'm just going to enter the patient's room. Upon entering the patient's room, I'm going to do my entrance safety check. So we're going to make sure the bed is in the lowest position, the call bell is within reach, the side rails are up as appropriate, and the patient is in no distress. So after I've done that, I'll introduce myself. Hi, my name is Taylor Purvis. I'm a University of Manitoba student nurse, and I'm going to be administering the medications today. So after I've done that, I'm just going to ask the patient for their name, so Jake Nursing, and his date of birth, so he says January 1st, 1960. From there, I'll double check with his wristband. So we have Jake Nursing, right patient, January 1st, 1960, January 1st, 1960. So those are his 2 unique identifiers, so that checks out. I'm just then going to ask him about allergies. He tells me he has no known allergies, so that checks out with our MAR, so that is correct. So at that point, I'm just going to let him know I'm going to be do my 3rd check, and then we will give him his injection. So from here, I'm going to do my 3rd check. So I'm just going to kind of set up my table here. So I'm going to get my syringe, my label, and my MAR, and I'm going to be comparing the 3 for my 3rd check. So we have Jake nursing, right patient. So date of birth January 1st, 1960. He has no known allergies, so that is good. So we have diamond hydrogenate, and this is diamond hydrogenate in here, so that's the right drug. We have 150 milligrams, so it's 50 milligrams per ml, so we have 3 mLs to give us 150. So this is 3 mLs with no bubbles, so that's the correct dose. We have intramuscular, this is the correct intramuscular needle. It's to be given daily at 2100, and I have 2030 on here, which is the correct time, so it's the 7th at 2030, so we're within the time frame, so I can go ahead and I can administer this drug now. So after I've done that, I'm just going to go to my patient and I'm going to explain to them the procedure. So today, as per doctor's orders, we're going to be giving you an injection. It's going to go in your ventrogluteal, which we've already discussed with the patient, and we'll landmark that later, but they're okay with that site. So we're going to be giving it into your ventrogluteal. It's going to be a needle that goes into your muscle and administers you medication for your nausea and vomiting for your chemotherapy. So once I've explained that to the patient, I'm going to make sure I raise the bed to the proper height and expose them accordingly before I give the injection. So right now, before I do that, I'm just going to tell them that I'm going to be assessing them beforehand. The things that I'm going to be assessing, I'll assess their nausea and vomiting, I'll assess their vital signs, their ins and outs, their daily weights, their for any hypersensitivity to the drug, as well as their blood or their serum electrolytes, So after I've explained all of that to the patient, what I'll be assessing, I'm going to just give them a couple side effects. So side effects for this drug include blurred vision, constipation, and drowsiness. And then I'm just going to give them a little bit of patient education. So patient education for this drug is that I would recommend they don't operate any heavy machinery because drowsiness is a side effect. I would recommend they avoid alcohol, and I would recommend that they take this drug with a meal. So after I've explained all of that to the patient, I'm just going to go ahead and I'm going to properly landmark. So like I said, I would raise the bed to the proper height. I would expose the patient, I would expose their left hip, and with my right hand, I'm going to landmark. So I'm going to have my palm is going to be on the greater trochanter, my thumb is going to be towards the patient's groin, my middle finger is going to be towards the iliac crest, and my pointer finger is going to be towards the iliac spine. So I'm going to be injecting into the muscle right between there. So I would obviously remove my hands because that would be dangerous, and in clinical practice, I would landmark by cleaning the spot and then leaving my alcohol swab there so I knew exactly where I landmarked. So after I've done that and I've landmarked and the patient has given me cooperation that they are okay with all of this, I'm just going to note that I have checked my hospital's policy and I'm not required to aspirate, but I just want you to know that I did check the hospital policy, so I'm not going to be aspirating today. So at that point, I'm going to go and I'm going to wash my hands and I'm going to apply my clean gloves. Okay, so after I've applied my clean gloves, I'm just going to note that we are going to be giving this injection at a 90-degree angle because it is intramuscular and we're going to be Z-tracking today. So after I've said that, I'm just going to grab my alcohol swab, I'm going to open it, I'm going to discard that in the garbage, and I'm going to be cleaning the site that I just landmarked for 30 seconds in a circular motion. We'll say that's 30 seconds, then I will allow that to dry. I'm going to throw that in the garbage. So I'm just going to grab my syringe here and I'm just going to hold it in the right way here. And I'm going to remove the cap and throw that in the garbage. I'm going to push down on the skin and I'm going to slide it sideways to Z-track, and I'm going to inject at a 90-degree angle. And I'm going to stabilize, and then I'm going to slowly and safely inject my medication. So once I've done that, I'm going to wait a couple seconds, and then I'm going to remove my stabilization. I'm going to remove the needle in a swift motion. I'm going to remove my Z-track, and I'm going to activate the safety of that needle, and I'm going to discard this in the sharps. For demo purposes, I'm not going to activate the safety, but that's what I would do, and then in the sharps. So after I've done that, I'm going to hold my cotton ball onto the spot where I gave the injection, making sure not to massage the site. So at that point, we're just going to say that's about 30 seconds, and we'll throw that in the garbage. From there, I will remove my clean gloves. I will discard those in the garbage. I will perform hand hygiene and I will document the procedure here. So I have 2030 and we have TPUMSN2. Okay, so that's good. So from there, I'm just going to talk to my patient and I'm going to let them know what we're going to be back to monitor for after giving this medication. So I'm going to be back to monitor for resolution of their nausea and vomiting, so the therapeutic effect. I'm going to be back to monitor their vital signs, their ins and outs, their daily weights, their serum electrolytes for any signs of hypersensitivity, for any signs of an allergic reaction, as well as for any signs of the side effects that I did tell them about. So after I explain that to them and let them know that they can call me on their call bell at any time and I can come back and reassess them. So at that point, I'm going to do my exit safety check, making sure the bed's in the lowest position, the call bell's within reach, the side rails are up as appropriate, and the patient is in no distress. I'm going to grab all of my supplies and I'm going to leave the patient's room. At this point, I would document anything that was appropriate for this specific medication. So vital signs, ins and outs, daily weights, serum electrolytes, and anything that is required for this medication and this hospital. At this point, I would also just make sure that I wrote my nursing IPN, and then at that point I'm done.